Good morning, welcome to another episode of Roll Call, TTSH Nursing's very own podcast brought to you by the Centre for Asian Nursing Studies. I'm Kim.
I'm Chloe.
And I'm Afina, and we will be the host of your episode today.
So today, we'll be breaking down some of the common misconceptions and myths of nursing.
Let's get right into it. Okay, so these are a combination of the ones that we've personally heard, plus those that you guys have submitted over Instagram. I think they're all pretty common. I think all of us have heard these before. So let's just jump right into it. I think the most popular one that we received is that nurses only wipe backside. Truth or myth? 1, 2, 3. Myth! Okay, so I think we very commonly hear that like, oh, all of you are just like glorified helpers. I think that's something that sadly like is very, very common. You really hear it quite often. Do you guys have any thoughts you want to share about it?
I guess previously, like in the old times, right? And then nurses are really more of aides. Yeah, so we actually help a lot of the bedside care and stuff. But as nursing has progressed and become of a higher caliber profession in a sense, then it's not only just like stuck to like wiping backside.
Backside.
Not only like
Yeah.
it's not really stuck to just wiping backsides and bedside work. It's a lot more behind the scenes.
True. And I think it's only truth maybe during Florence Nightingale time lah. And it's like, like very, very simple nursing bedside care. But as Chloe said, now it has progressed. And even our friend Megan, she went for the APN course. And I think once she graduates, she can really like prescribe medication, run their own clinics and all. So there's definitely like a shift from that. And maybe some nurses now, they don't even wipe backside anymore. Right, because they have like researchers, informaticians,
Yeah, if you want to find out more, so APN is Advanced Practice Nurse. We actually interviewed an APN, Sister Fiona. She's a palliative APN. So we interviewed her on one of the first few episodes of Roll Call. So if you want to find out a bit more about what APNs do, which is really, really crazy work because like what Afina said, they can go for courses, which allow them to prescribe medication. Basically, they follow the doctor's rounds. They're a lot more on the medical side already, run their own clinics, see patients for more chronic conditions and all that. So it's very, very cool how the role has progressed, especially since like my grandma's time. So my grandma was a senior assistant nurse. So she would tell me how like she will like take the boat in the kampong, then go people's house and like help them to do wound dressing and all that kind of stuff. So I think the roles, it's not so much just like wipe backside, but it's a lot more like functional, really bedside care in that sense. Whereas I feel like now nursing has progressed to something where the nurses have a lot more autonomy and a lot more, how do I say this? Like, the empowerment is there. And I'm not sure, I can't remember whether the shared governance episode is going to be before or after this episode, but they talk a lot about like how we are working very hard, especially in TTSH now, to empower our ground nurses to do a lot more critical thinking and stuff beyond just like your clinical day-to-day work. So stay tuned, or I hope that you enjoyed the episode. And I think Chloe also added a point about like studying nursing in poly and in uni. How was the experience like for y'all?
Oh, okay. I mean, not trying to like brag or anything, right? But to me, poly was like, it was not tough. It was not tough.
Oh.
Right? If you agree.
To be fair, all of us did courses that weren't nursing in poly, so we all switched to nursing in uni. Okay, sorry, continue.
It was a major switch. It was like, because I had zero nursing background and then I wasn't even from like a science course or anything. It was a business course. So when I came into it, I was just like slapped left, right, center with all these massive
all the medical terms, all that, right?
Terms, then information, anatomy, pharmacology, everything just piled on. And like, if people think it's easy, right, we should try it.
You should try it.
You should try it. I think there's a common misconception that like, nursing, it's just a course where like, very easy to get in so it probably wouldn't be that hard. But honestly, I think I have seen quite a few dropouts because it's very rigorous. And even the clinical attachments also, people can't get used to being in like close proximity and in the healthcare setting.
I've also heard that over the years, it's starting to become a lot more competitive. I think from Chloe and my time, from what we heard, the cohorts are now like getting bigger and bigger, and I think more people are showing interest in nursing, and also I think seeing how nursing has evolved has attracted more people to join as well, because you have a lot more job opportunities out there. once you have like a background in nursing lah. So yeah, 100%. When I did my like education switch also, I remember the first, I think it took me like a few months, right? I remember in class, right, I'll be sitting there, because I did mass comm, right, in poly. So like, from going into like, oh, okay, how do you direct like a shoot? Or like, how do you like do radio? Then after that, I sat down, then I was like, okay, then like, I had to like memorize like anatomy and pharmacology. Oh, I died. I remember I was sitting there, I was like, honestly, what am I doing in my life? Do I want this kind of responsibility? Like, oh, serious, you know? So like, it took me, I think almost about a year for me to really like,
assimilating somewhat, you know.
and the mugging and the trying to catch up with the content and all that was crazy. Yeah, I remember like after class every day, like I would have to go back and refresh. If not, I will completely forget what the lecturer just taught. Over the weekends also, I'll be like doing practice quizzes and everything because it's very scary. I can't remember whether we had bell curve.
We had, yeah. So you were not only competing with like the actual like resources and the education that you're given to you, but you're competing with like other people,
Friends.
yeah, your friends, your classmates, because there's a bell curve, because of the area of like you know the school basically they can't produce like all A students.
But of course, this is not to deter anyone from studying nursing. Okay, it was a very enjoyable experience. Okay, right? Yeah, it was. It was
Come
nice.
join us.
It was, and I think that actually this goes straight into our next myth.
Yes.
Myth or truth, which is nursing is for people who are too dumb to be doctors but want to join healthcare. Truth or myth? 1, 2, 3. Myth. Actually, this is super common. Like
It is.
you guys have heard patients like ask you before also.
Definitely.
They will say things like, actually you did degree, right? Like you're smart enough to go to uni. Then how come you don't want to be doctor and be do medicine? How come you choose to do nursing? Or now you like that, you're very good, right? Actually you should become doctor. Go and study again, become doctor.
Yeah. So how do you like, you know, tell the patients or like the families that like, no, I don't want to be that?
Yeah, I think to me it's just like it's two different, completely like different profession. Like doctors are more towards like treating and diagnosing the patients, but nurses are more towards like the holistic care, you know, like emotional, the physical care. So it's like definitely like two different professions. It's not like just because you cannot become a doctor, then you default to become a nurse. Like that's definitely not the case. Yeah, we go through like very different training programs.
Yeah, definitely. I always tell my patients, so also you don't want me to be here with you 24/7? What are you trying to say? No, I'm just kidding. Because nurses, I mean, like the part of, I think the difficult and stressful part, but at the same time, the very rewarding part about being a nurse is that you are really with the patients 24/7. So like you really see them throughout their day. You get familiar with their routines, especially those that stay for very long. But at the same time, you also see them, I think, like really at their most vulnerable. There is that additional stress also because you are the first in line to like respond if let's say something happens to your patient. You are the one that has to like escalate it to a doctor. The doctors are not there with the patients 24/7. They have many wards to cover, especially when they're on call overnight. So it really is two very different job scopes.
Correct, I agree. And that's why they say like nurses are usually the eyes and ears of the hospital because we are the one that actually like see everything on the ground and we'll escalate before it gets more severe.
Yeah, definitely. I feel like what I like about nursing is because of the amount of contact time we have with our patients, right? It's like I can just remember all my patients like special orders, like, oh, I want tea with less milk and like 2 packets of sugar. You know, so these type of things is what makes it very special for us, and that we can, you know, build some rapport and then chit chat, have some fun with our patients, in spite of them like being in the hospital. So it takes their mind off this.
Yeah, exactly. And I think beyond beyond the job scope wise, some people have the misconception that as a nurse, right, you don't have any much prospects after you graduate, which I think we talked about a bit just now already. And I think the general consensus is that it's a very different time now.
It's not
a very different time now. There's so many different like routes that we can explore and go to.
I still think a lot of nurses, and I mean general public, they don't know the different types of like routes that we can actually explore in nursing. So it is really up to the nurse to go and like want to explore. And like find his or her own way into this nursing world. In a sense,
it's true. Because it's all still very new, like having all this like innovation in nursing, even like media and all that. It's still very new. So maybe people might not really relate nursing to all these things. But there's definitely like a lot of prospects in nursing, not like olden times.
I think all of us have one common like is the word trait or like purpose? Like a lot of us join because either we really like the work or like there's a lot of personal passions and reasons to why we join nursing. I think that's a very common goal, but I think now it's expanded beyond like just, if you're a nurse, right, it just means that like I'm very good at like some maths. I'm very good at like doing this particular skill set, you know? Like I think now we are trying to build on people's skills and passions like that
outside
they also
of-
have
yeah.
outside, and see how we can bring it to contribute into nursing, which is also another fantastic way I feel to empower your ground staff.
Yeah,
you know, like that you are special. We see beyond just like you as a nurse, but we really see you as an individual and see how you can bring all these skills and talents into our profession, which is something
Right.
I think we are very happy to have here, especially at TTSH and HG. Yeah. Okay, you want to share the next one?
Okay, so the next one is, I think it's a very common one that you hear a lot, is that the older eat their young. Is it true? 3, 2, 1.
50-50. Okay, no.
Yeah, it's like depending on how the person is, right? Like I would say this lah, doesn't mean you're a nurse means you are a better person already. You know, it's still the person still has his or her own personality, and I think that will be brought over to the workplace as well.
That's true.
Yeah, so someone can be really fierce, really like more dominant at home or outside. So it could be brought over to the workplace, which could be seen as very aggressive or like very standoffish kind.
Yeah. I feel like I'm having a little bit of deja vu moment here. But I think like in one of our previous episodes, we did like kind of touch on something like that as well, about like, I think people send in some stories and saying that, you know, like my supervisors or like my seniors are very mean to me, they're very strict, like why is it always like that? Then I feel very trapped. So I feel like it is, okay, that's why I say 50-50.
Yeah, I think personal experience.
Yeah, it's a
like
really-
we won't discount your experience.
Yeah.
Like we see you, because like what Chloe said also, it depends a lot on the individual. So for example, I feel like maybe there's a more like underlying issue. Maybe the person is just like stressed or exhausted, burnt out, right? And then the way they like let it out is through like, you know,
Snapping
yeah,
or like,
snapping, and then going off at the younger, yeah.
Just snapping.
So it's actually not fair to generalize like all the senior nurses are actually like out there eating their youngs, because honestly I've come across like very good senior nurses who are great mentors, leaders who have really helped shape me the way I am today.
Yeah.
So
Yeah, I'm pretty sure for every like one slightly scarier, angry senior nurse, there's like
nice one.
10 or 20 lovely ones.
Correct,
You know?
correct,
But maybe
yeah.
you just super sway, you kena that one as your preceptor.
Yeah,
you know.
yeah, that's right.
You know, but the nursing world is so big. The nurse, like here in TTSH, we have like 4,000 nurses. I'm pretty sure not all of us are. Like that's
Yeah,
really
correct.
mean. Yeah.
I don't think I mean.
I don't think I mean too.
you're nice, you're nice.
Yeah. So, but I mean, of course, you can please watch our previous episodes. I think we also shared about like how if you feel like you're stuck in this certain situation, like how you can try to bring it up to your senior. There's any like how to share and talk about all these kind of like have these kind of difficult conversations, like which I feel are very necessary.
Correct.
As with anyone, your friends, your family, confirm sometimes you will clash also.
Yeah.
Yeah, that's true.
Do you want to say something?
Yeah, no, I don't know whether you guys agree, but I feel like the younger generation, like the Gen Zs, right? They really know how to stand up for themselves.
Oh, right.
Yeah,
right.
and I've experienced it. Like I saw it, I witnessed it myself. So I was like doing clinical attachment. So there was this like senior staff that was scolding the new hire lah. Because you can see that I'm new batch, right?
Yeah.
So she was scolding. She was really like raising her voice, and you can see it was very unprofessional. So the new staff just like straight up look at her and say, "I don't appreciate the tone that you're talking to me. We can resume this conversation when you learn how to speak like an adult." Then she just walked away, and I was like, "Wow, go off, girl."
That's ballsy.
Yeah, really. And then after that, like you can see the senior was like visibly shocked. Like she was just like taken aback. Then after that, she really go and apologize to her. I think it was just a one-off thing lah. But yeah, I think the newer generation know how to stand up for themselves. Some of them, yeah.
Definitely more than some.
Okay, let's go to the next one, which is nurses always scold patients and don't let them eat or drink, make us suffer. Actually, this is quite common. I feel like a lot of aunties and uncles, right? They don't understand. Like example, maybe we are waiting for them to go for a certain scan, or we're waiting for them to prepare for like a certain surgery. Then they're like, why? Okay, but honestly, sometimes feels a bit bad. Sometimes you okay, so for surgeries, for example, we have emergency and we have elective surgeries. So emergency are obviously those that, like, example, like road traffic accidents, like things that are like, or suddenly the patient deteriorate, they have to do an emergency operation on them. Then you have elective, which is more like your hip surgery, your total knee replacement, like not so urgent. So I've gotten into a bit of like hoo-has with like family members about this before, because they don't really understand that for elective and emergency operations, there's two different queues. It's two different queues, okay? So of course, if let's say the doctor thinks that, okay, I don't think that it's extremely like crucial now that you have to do the surgery ASAP, right? They will likely put you in the maybe the more elective queue. But for some, they'll put in the emergency queue. But obviously, if like suddenly got one like major traffic accident or trauma case or something, they will prioritize that first. So because of that and the like uncertainty, then sometimes your surgeries can get postponed and it's like very last minute, you know, like maybe we're almost preparing you already, then like suddenly the OT calls, then they're like, actually sorry, like might have to wait a while. Then they get very frustrated. Not just the patients, but like their family members also. So then we were gonna scolded lah, you know, because they don't really understand that. But at the same time, I can understand also because like your stomach like and you're just like so hungry, then you're just like, just please, just like one biscuit, please. But then we are like, no, sorry, cannot.
Correct.
Okay, I mean, I guess in a lot of situations, because I'm from a general surgery ward, right? So we have a lot of situations where patients have to be kept new by mouth, or NBM for short, for preparations of scans, of surgeries. So a lot of these cases where sometimes it may get delayed and postponed up to like, I think the longest I've seen like a surgery took place only about 2.5 days later.
Oh,
wow.
Yeah.
NBM came for.
Yeah, so obviously the patient and the family weren't very happy, but it was just a very busy period at that time. So they had a lot of emergency slot-in cases. And like, although you can be in the queue, right, you can be next, but maybe that certain doctor that's performing your operation has to be in that emergency, has to be an emergency case. So because of all this, but it's very hard to explain it to the patients because on their end, they're very
just frustrated and hungry.
Yeah. So as much as we try, we are definitely not making them suffer.
Correct.
I had one patient's family member before that told me, give me the doctor's handphone number, I want to call. I said, ma'am, if the surgery was postponed, I'm pretty sure he's like in some OT right now, like working on some trauma case. I don't think he can pick up your call. So I mean, as much as obviously we empathize and we understand the frustrations, we're really just also trying to do our job. We're not starving you on purpose. I promise you. And maybe I want to share also, like, why do we have to keep them NBM? Why can't they eat or drink water sometimes?
Okay, so like, because when patients go for surgeries, most of the time they're put under general anesthesia, which is GA for short. And when this happens, the medications that we give to the patients actually relax all their, muscles to put them under. And this will cause like, as what I said, all the muscles to like relax, right? And if you have any food or liquids in your stomach, you may actually regurgitate it and you may go into your lungs. And it's what we call aspiration. So when this happens, it's going to be very bad.
It's not very good.
It's going to be messy. And maybe the intubation part also, because when you're under GA, you probably get intubated. And then like all the food particles, imagine like coming out of your mouth. It's not pretty.
Once it gets into the lungs, it's hard to get it out. And it will cause a lot of risk for infection and such.
Correct. But honestly, right, I don't mind being the bad nurse if it's for the good of my patient. Like for example, like not just like NBM, you have other things like maybe going to the toilet. Like maybe your patient cannot walk, right? Or like one-sided weakness, and then you keep telling them, oh, you cannot go to the toilet because it's not safe for you. But they like die want to go, and then I don't mind them being angry at me if it means that they are safe. Like I would rather bring you to the toilet rather than bring the toilet to you. Like bring the urinal and all that. Because it's much more like work to do to bring the toilet to them. So if I could, I would want you to go to the toilet also, but it's just for your safety, I couldn't.
I think sometimes a lot of patients and family members have this misconception that we don't want to do it because we're lazy. You just don't want to help bring me to the toilet, But sometimes realistically speaking, not lazy, but like we are very short on manpower. If you're someone that needs 2 people to support and carry you, and honestly, I mean, like I've had so many experiences where I tried by myself and I'm like, no, this is super duper not safe.
Break your back,
you really need two, not just 2 people, 2 strong people to carry certain patients, right? Like the risk that you will fall and like have like fractures and so many other complications to us it definitely doesn't outweigh. The risk doesn't outweigh the benefit.
Yes, correct. That's true.
So I mean, I think then on the healthcare professionals, I think like the most important thing for us is to show empathy to the patients and to really show that we are on your side. We really know that dignity and all that kind of stuff. I mean, peeing like on a pamper in the bed compared to being able to go to the toilet and clean up after yourself. It's two very different experiences, you know. So we definitely understand that it definitely will have some discomfort and uncomfortableness in that period of time, but we really prioritize your safety above that.
Yeah, correct.
So hope that you remember that we are on your side, okay? We're here to work together with you.
Not
More
against
patience
you.
with us.
Have more patience, not patience. Like, we generally hope that people will be safe and healthy and don't come to the hospital, okay?
Yes, that's right.
Yeah, and I think our last one that Chloe added
Okay.
is, you want to say
I
it?
think a lot of people ask, so you know, they know that you work in the hospitals. So they're like, oh, so got see things or not? Or got ghosts, or like, is it haunted, you know? So, is it a myth or?
Okay, shall we do it?
Yeah, okay. 1, 2, 3.
Myth.
Truth.
Oh.
Again.
Okay, I think based on personal experience.
Oh, yeah, based on personal experience.
Yeah, because for
true.
myself, I've never witnessed anything like, thankfully. Even when I was working at the CDC block, which was the oldest building,
your level
most in
six,
front of
right?
saying,
Yeah.
supposedly the most haunted. I never witnessed anything. So yeah, I hope it remains like that for the rest of my career.
I hope so too. I mean, I guess depending on like certain different religions and all, they have different ways of perceiving like, you know, what is
Understanding
out of-
what's happening.
Yeah, what is happening and stuff. And some people will have what we call like third eye or more sensations. Or, yeah.
Okay.
So personally, I haven't really experienced anything firsthand, but there are always strange things that happens. Like previously when I was in the C-class wards, right, and then there was the toilets are not in the attached cubicles, so it was the shared common toilets outside. So then I will be sitting at like the cubicle next to that shared toilet, and then I don't see or hear anyone walking behind me.
Okay.
But the toilet in the the toilet in
The cubicle in the toilet.
one of the
The
toilets
cubicle
in
won't
the
be in
shared
the
toilet
Yeah.
kept flushing. And then the door was like opening and closing of that like certain cubicle toilet door. But there was no one. So after that, I just quietly moved to another seat.
Like while you were like
Like it was during
halfway?
night shift,
Oh,
yeah.
okay.
So I
Oh,
was
maybe
like,
it's just
like, doing
plumbing
my
issue
charts.
lah. Plumbing issue.
No, the
The
door
door.
so
The wind is the wind. That's always the explanation.
Is it? Okay. Yeah.
Maybe that's why I never see anything. I just like
La, la, la.
think, it's just the wind.
That's why I think like again, it boils down to how you
Yeah.
process things. I also have not personally witnessed anything yet, but I've heard a lot of different stories from different people. And I think the fun, cute part is that the way people deal with it is also very interesting. It's very, very fun. The way that they process it, but beyond that, like the way that they deal with it is very interesting. So like, it's very cool to see how like different people with different religions and beliefs, right? Like how they combat these spirits. Yeah.
To some, everything is explainable.
Yeah. Yes.
Like, oh, wiring issue. Oh,
The wind.
Correct. And if you want to hear more about different horror stories, not just from us but also from submissions, we had a Halloween episode last year where I'm pretty sure I was in a watermelon.
Yeah, I think
I was
you're
in
in
a
some
watermelon
costume.
suit.
You're in a
Yeah,
costume.
you can go and watch that. It's quite funny. Yeah, and with that, we're done with myths or misconceptions, common ones that we hear and you guys have also shared with us about nursing. You can also check out our podcast and this episode on Spotify at Nurses of TTSH.
So do give our channel a follow and hit the bell to get notifications whenever a new episode is posted.
And follow us on IG and TikTok at Nurses of TTSH.
Not TTSH of nurses.
Oh.
Wait, what? Wait, that's the right one.